Hi, Dr. Ruby Payne, and we are on Chapter 7 of Emotional Poverty Book 1. And this chapter looks at additional factors that really shape emotional realities. What we know is that one of the things that's in this chapter is the ACEs quiz, and it's in this chapter on page 113. It is the quiz that is basic to adverse childhood experiences research. And if you are not aware of this research, it has become the foundation of a lot of the trauma-based research that has been done. And it started in the early 70s in the medical field. There was a doctor who noticed that when many of his patients came in to see him that had chronic illnesses in their 30s and 40s, as he started questioning them about their early childhood and their childhood, many of them reported adverse conditions. So he reported on this at a conference, a medical conference. Well, he was basically laughed out of the room. People just thought it was impossible. But there was a gentleman there from CDC, and he said to him, this is very interesting. We should research this. So they did. And what they found is they established 10 questions, and each one that you answer yes to, the higher your score, the more adverse childhood experiences they found. As it relates to student achievement, they found that if you had over 4, it significantly reduced your academic achievement. Over 6, they found that there were many diagnosable mental health issues. And one of the things that I thought was fascinating in this research is this. The one thing that erased or ameliorated many of the effects of adverse childhood experiences is whether you had one good adult. Did you have one good, caring, nurturing adult relationship? It had the power to erase many of those effects. So adverse childhood experiences are another tool you can use in emotional triage. You can identify what kind of adverse childhood experiences has this child had, which would elevate them higher on the list of people to watch emotionally. The other key question is, do they have a good adult in their life? Additionally, some other descriptions in this chapter have to do with actual mental illness. And I want to say a couple things about this. There are some mental illnesses that do have a genetic tendencies. One of them is schizophrenia. Freud, who studied this extensively, said this. He said that he defined sane as the ability to work and love. Now, all of us have done things that we consider to be just slightly insane. But the issue around sanity is, can you work and love, and basically, does it most of the time not interfere or disrupt with your daily life? So what Freud said, or in the field of mental health, basically, about 94% of people, 90% of people, if you will, are quote unquote sane most of the time, okay? 3 to 4% are insane, okay? They literally cannot work or love. And then there's this 5 to 6% in there that are what they call borderline. Sometimes they are, sometimes they're not. If you want to read more about this, there's Wikipedia. You can go Axis 1 and Axis 2. Axis 1 is closer to sanity. Axis 2 is closer to insanity. The bottom line is the continuum. And what we know is that some mental illness, like schizophrenia, actually has an age marker. In other words, an age onset. And a lot of times it's in the mid-20s. On a personal note, I had an aunt. She was my mother's brother's wife, okay, who struggled all her life. And she had 5 children. Of her 5 children, 4 have it and 1 does not. And the one who has it most intensely, the onset was 40. And within 6 months, he lost his job, he lost his employment, he basically became non-functioning. And so one of the things in his ability to love and work, and one of the things is it is a reality. When we look at the bigger picture of emotional realities, I need to say this, that about 10% of your DNA is programmed. About 90% of it is shifted by the environment. There is a whole field of study called epigenetics. Beyond, epi means beyond genetics. And epigenetics is when the environment has the ability to switch genes on and off. And what we know is that it's a reality in addition to the many other factors that occur to people. Chapter 9 is simply a chapter. It's a bonus to you as a reader. It's how to manage your own life, strategies for that if you want more emotional stability. But Chapter 7 and Chapter 9 are additional tools and understandings about emotional poverty.